Welcome to the next episode of our mini series of podcast Diversity, Equity, and Inclusion under Radcliffe Cardiology. My name is Julia Grapsa, and with my friend and partner in crime, Dr. Mirvat Alasnag. And today we welcome a wonderful colleague and friend, Dr. Marta Bande. She has over a decade of clinical experience and as a cardiologist, and she's a distinguished interventional cardiologist at Boston Scientific Corporation at the moment in Milan. And she has previously served as a consultant interventional cardiologist in Milan. So Dr. Bande actually, she graduated from Sardinia and she went to Mount Sinai Medical Center in Miami Heart Institute with scholarships, and she then completed a cardiology fellowship in Paris Sud in Paris in 2008. And she's currently a fellow of the Society for Cardiovascular Angiography, the SCI, and Interventions, and a respected international conference speaker. And she has a great interest in equity, diversity, structural heart disease, complex coronary interventions. Marta, welcome. Thank you so much for accepting to do this podcast. And we call this podcast Transition of Career, Equity and Diversity. As I was walking today, I thought it could be named rather transition transformation in a way because it has a positive meaning. And I want to start with the first question. What motivated you to become a cardiologist?
Oh, first of all, Julia and Mirvat, let me thank you for the privilege of being here today. Thank you so much for this very kind invitation. As you said, we're friends, colleagues, and we fight for the same goals and objectives. So it's great to be here today. So becoming a physician has actually been a lifelong dream. As a kid, I was fascinated by white coats, by the aura of mystery that surrounded the hospitals at that time. They were very well respected. And I also the intention, I would say, to do something meaningful and worthwhile in my life. So I made my decision on the spot when I was 8 years old after watching at school a recording of physicians who were supporting humanitarian efforts in Africa. That day, my school apron became my white coat, my vision was set, and I never changed my mind. The decision to choose cardiology instead has been strictly intertwined with interventional cardiology because I followed in my father's footsteps, and the choice was sparked by witnessing my dad's passion and unwavering dedication to his job. In fact, he's still practicing today as a clinical cardiology. Uh, I saw interventional cardiology as the perfect mix of clinical and procedural expertise, and as a field that was constantly growing and innovating. And when I entered the cath lab, I simply fell in love with it.
Julia even mentioned, your career to move into the field of cardiology, and very clearly you started early. But Marta, you did something very interesting as well, and you made a very, almost a 180-degree shift in your career. And it was a very bold move when you decided to move to industry. So can you tell us a little bit about that? Why did you do it, and what prompted you, and what's your experience like there?
Sure. So moving to industry, Mirvat, is something that has been completely unexpected and that I could have never predicted in my life. It's been, I would say, the result of curiosity meeting opportunity. Only a few years ago, I learned that physicians could work in industry. It's something that I wasn't aware of, and that I learned when I was introduced to a physician who was working at that time for a medical device company. I became curious. I started connecting with other physicians who had transitioned. And ultimately, this network led me to the opportunity to join the EMEA Medical Affairs team at Boston Scientific. At that time, I was mid-career. I was starting to ask myself what my career progression would look like, what the next step would be. And I just decided to take the leap and challenge myself in a completely new environment.
And Marta, I mean, you're a powerhouse, and it's amazing how you took this step while you're a very active interventional cardiologist. What are the take home messages from working in an industry?
So, Julia, first of all, I would say that moving to industry after a significant experience in clinical practice gives you the unique opportunity to gain a 360 degrees view on interventional cardiology, and also a chance to learn new skills, being exposed to experiences that are quite different from the ones we have as practicing interventional cardiologists. And you also realize that a successful partnership between physicians and industry can really impact and improve patients' outcomes. Also, I would say that it is quite fascinating to witness firsthand that as physicians, we are lifelong learners, um, resilient, hardworking individuals with a strong work ethic, and we possess a wide array of skills that and expertise also that can be translated into a different way of serving our patients and making an impact. Uh, we can do hard things, and I do believe that we are set to be successful no matter what we do. Um, a great learning has been being from this side that being a physician and caring for patients is truly a privilege. So, my takeaway here would be that I would never take it for granted anymore.
Marta, you're very uniquely positioned, both as an interventional cardiologist and a friend, I would say, but also as somebody who has ventured into industry. You have a very pivotal role in promoting diversity and inclusion in women in cardiology, and you've orchestrated a lot of programs and activities in multiple educational conferences happening across the globe, where you actually address issues of gaslighting, harassment, and so on. Can you tell us a little bit more about your role and how you can amplify and be a voice of change?
Thank you, Mirvat. As you know, I believe in the importance of creating a community, a strong community of women professionals who share the same challenges. And this is extremely important to avoid feelings of isolation and inadequacy that sometimes can affect women physicians. And it's been my own experience that has prompted my commitment, I would say, to fully support other women along the way and with the means that I have. Um, we know that there is growing evidence that women physicians are not only as good as our male counterparts, but in some instances, they can actually obtain better clinical and procedural outcomes when patients are under their care. And in spite of this, we have been lacking as women physicians opportunities. And this is where it's really important to support each other in any way we can. In any field, diversity is important, but I do believe that in our field it is particularly critical because women need to be involved on both sides as patients and as investigators in clinical trials that are dedicated to investigate cardiovascular disease. And also, it is quite important that we provide role models for younger generations who aspire to become physicians.
And Marta, as we were discussing, in several occasions, in person, we have, and you mentioned that women are having a tough time, and they're facing a lot of difficulties, and you are speaking up. Have you ever faced a situation that you felt stuck, or you felt that you didn't know what to do? And could you tell us more on how actually you navigate through the situation in order to have the best plan for your life?
Certainly, I can, Julia. I can't recall a specific episode, but I can tell you that I have felt stuck multiple times over the course of my career. What I have learned along the way is to make a conscious decision to get unstuck. I have learned, and believe me, I've learned this the hard way, that if you wait for someone to come and save you, or for someone to come and give you an opportunity for change, you might as well wait forever. I always keep in mind Albert Einstein's quote, who said, insanity is doing the same thing over and over again and expect different results. So you cannot really keep on doing the same thing over and over again and expect things to change. So when you feel stuck, you really need to face the challenge heads on, and find other ways to pivot. Um, so along the way, I simply learned to create my own opportunities, and this can be done in multiple ways. Mm, I would suggest, first and foremost, to never underestimate the importance of consistent hard work and striving really for excellence no matter what you do. Because you think that people might not be watching, and then instead, suddenly comes a day when you realize that other people, other colleagues have been noticing your work, and they are very willing to help and give you opportunities. Also, I would say it would be important to build a strong network, because you never know where the next opportunity may come from. Um, don't be afraid to get out of your comfort zone, reach out to other people, because I can really say that this is true. Most of the times, they will be willing to help.
And along those same lines, Marta, I want to ask you, young cardiologists who are still in their early career and not reached mid-career and so on, and thinking of changing their career trajectory, what would your advice be then? Would you say, yes, it is time to shift gear? Would you say stick with it? What solutions and advice do you have?
Sure, Mirvat. I would say that there is no one size fits all solution. We have to remember that we are the owners of our own career. Uh, my mantra is blaze your own trail. I believe in choices that sometimes may be uncomfortable or unconventional, but that reflect what you need to do for yourself at that specific moment. We are constantly reassessing our goals as we move along this journey that is life. And I found out also that our dreams, our aspirations, our priorities may change over time and over the course of our careers. Today, the traditional career that saw a physician working in the same hospital for 30, 35 years is slowly disappearing. And we really have several opportunities to shape up our careers, shape really our own path, as long as we're not afraid to make bold choices and decisions. So my advice to this young cardiologist would really be to give yourself the opportunity to explore what may work best for her. So persevere if you feel that it's the right thing to do. Otherwise, don't be afraid to change if you feel that that's what you need, or you feel the need to do. Find your own path, because today really we have endless possibilities. And I would tell her to remember, first and foremost, that no matter what she chooses, she's a fantastic woman, a great physician, and a very precious human being. So not to give up, because pivoting doesn't equal giving up. It's just a different way of navigating the course of our career. I would leave you with another favorite quote of mine that assisted me during my transition when I was shocked at my own choice because it was really not expected. It drifted away from all that I had dreamt of for my whole life. But it is that life has more imagination than we carry in our dreams. And that's a quote from Cristoforo Colombo. So thank you very much.
So, Mirvat, we reached to the end of this podcast. So I would like to thank you, Marta. Thank you so much, Mirvat. It was an excellent podcast, very inspiring. We learned a lot. And Mirvat, any final comments?
No, thank you very much for leading this, and thank you, Marta, for your insights. I think you do offer a very unique perspective, and I'm glad that our listeners have an opportunity to gain from your experience as they manage through their own difficulties that they're encountering.
Thank you very much, Julia and Mirvat, once again. Thank you.